I'd like for you to find a comfortable position for your body, and that might be where you put your feet on the ground flat. Sort of center your spine down to your body, down to your seat. And pay attention to where you put your hands. Some people like to put their hands right on top of their thigh. Some people like to clasp it together ever so loosely. So find a place where you feel comfortable in your body, as comfortable as possible. And I'm going to take you through a relaxation exercise. And if you like to, please feel free to go ahead and disconnect the video part of your Zoom, or you can leave it on as well, whatever feels most comfortable. So find that position where you feel that your body just sinks into your chair. Feel that connection of your feet to the ground. Notice how that feels. That almost imperceptible tingling between your feet and the ground. Notice how your hands lay upon your legs. It's just about noticing. No judgment, just noticing. I want you to notice your breath now. Breathing in and breathing out. Breathing in and breathing out. And as you breathe in, feel the sensation of the air flowing through your nose and your mouth. Do you notice the temperature? Do you notice the aroma? Do you feel the flow as life-sustaining air courses through your body, through your lungs? Notice how your body responds to the air, how it feels nourished. That deep inhalation. Filling your body with nourishment, with energy, with life-sustaining oxygen. Now I want you to turn to your out breath. Feel the flow of air go through your nostrils, through your mouth. Notice how your body responds as you breathe out. The muscles relax. The tension dissipates a little bit at a time as you breathe out. Breathing in, feel the energy fulfill you. Breathing out, letting go of the tension in your body. Breathing out, imagine the tension of the day, the tension of the week, leaving your body, even as you breathe out. And breathing in, that tension replaced by life-giving air and energy. And notice the stillness in between your breath. Breathing in, pause. Notice the stillness. Breathing out, your body sinks deeper into letting go, relaxing. Now, take a few moments to open your eyes, turn on your video, and let's center back. Let's center back to our call here. A few more breaths. And let me know that you're with us by turning your video back on if you can. So this is an exercise that I use to center myself throughout the day. And if you notice, it probably only took a couple of minutes to do. And so during the moments of breaks that I have, I'll try to just center myself and relax my body, because so much of our stress and anxiety gets expressed through our bodies. And so I wanted us to all, as we enter this discussion about coping, that we have some tools already that we can use to just relax a bit and to pay attention to what our body has to say, and then to pay attention to what we have to say here in this Zoom conference.
I think, Dr. Ton, there's some people here who may or may not know your profession. So I was wondering if you could share your background with us.
Sure. Yeah, I guess it might have been kind of awkward to do this meditation exercise, and you don't know who this Hendry guy is, right? So my name's Hendry Ton, and I am a psychiatrist. I've been practicing psychiatry and working with underserved communities for about 20 years now. My focus in psychiatry is what we would call humanistic approaches, so humanistic psychology. And that approach is really to look at humans as full potential beings who can actually go to great heights of development and contribution to the world. I'm also the Associate Vice Chancellor for Health Equity, Diversity, and Inclusion, and I just became the permanent Vice Chancellor a couple of months ago, but has been the interim Associate Vice Chancellor for the past 2.5 years.
So, Dr. Ton, given the seriousness of this crisis, can you share the types of stress that people have been experiencing, such as loss of sleep, anxiety? Can you share with us the types that you've come across or people have talked to you about?
Sure. So I think that first it might be helpful to talk about what is causing the anxiety for people. So I think the first and foremost thing is that people are afraid to get infected. They're afraid of becoming sick. I think there's a lot on the news, on the media outlets that we're reading that can sort of provoke that kind of fear of getting infected and becoming sick. But I think the other thing is that people are anxious and stressed about the disruptions that we've been having in our daily life, working from home. You know, the institutions that we're used to in our neighborhoods and in our communities have been disrupted. You know, as we need to do sheltering at home, that has also caused some disruptions in our everyday life. I want to also take it to teleworking as well. You know, staff have expressed to me concerns and challenges with making that transition from working at the health system or at the university to making sure everything is set up so that they can work from home. And so that kind of disruption, that transition from being at work in a workspace to being in a home space can be very challenging. it also, a lot of people here have kids in universities or in grade school, high schools, middle schools. And so seeing their kids coming home and worrying about, okay, how do I keep my children safe? How do I work from home while at the same time taking care of the needs of my children, given that childcare and schools are closed now? All this can impact our sense of community support, which I think the majority of people, if not all people, a sense of community is a buffer against stress. I think the other thing is that the pandemic is evolving, and we're learning new information every day about that, and that level of uncertainty is I think very, very challenging. I'm seeing a message from someone that one of the other challenges is that we're seeing people that we love risk eviction, starvation, homelessness right now, and so carrying that weight and the question of how are we supposed to continue business as usual when these challenges exist. I think as well, those who, related to that sense of responsibility is the challenge of some of us are health professionals, some of us manage teams. And so I think it's also stressful to take care of others in this time of uncertainty as well. And so those are some of the stresses that I'm hearing from. I'm also reading on the messaging section that the concerns that the university is not allowing for administrative leave for mental health, and there are some provisions that the university is putting in place for people who do need to take care of family members and whatnot. I think that the way that we deal with stress and the way that stress manifests is different for everyone. But Yvonne, as you said, some of the things that are indicators that anxiety is playing a role in our lives is that we start to worry more about our own health or health of our loved ones. We may have difficulty sleeping. Our eating patterns may change as well. We might feel a little bit more irritated, short-tempered. We might have trouble concentrating as well. Some of us may actually find that our chronic health conditions may worsen as well. For a lot of people, the stress doesn't just manifest in how we feel emotionally, but it can also manifest in how we experience the world physically as well. And so, it's good to pay attention to these signs because we can actually do things to help decrease our stress level. And those signs are an indication of how much attention we should be paying to coping strategies and wellness exercises like the one that we just participated in earlier today. The other thing I want to also mention is that there are people who may respond more strongly to stress of a crisis. In this particular situation, people who are particularly vulnerable to COVID-19, such as elders in the community, people with chronic lung and heart disease, may feel an added level of distress. Children and teens, I think, may also experience a significant amount of distress. Although as adults, I think that we have ways in which we can help them to cope with things. And then people who have pre-existing mental health conditions and substance use conditions can also experience a magnification of those challenges during these times of crisis.
So, Dr. Ton, when because we know that people can tend to allow the stress to get to a point where, as you said, the fears set in. How do we know when to kind of like take in those breathing techniques, how to cope with this, and not allow it to get out of control?
Thank you. So the question is, given everything that's going on, how do we know when to take a moment out of our time to de-stress, do some of these exercises? And, some of us are very in tune with our stress levels, and others of us are not very in tune with it. And so what I recommend is actually building de-stressing into your daily practice so that you don't actually have to spend a lot of energy thinking about, oh, am I stressed or am I not stressed throughout the day. So some of the things that you can do in the morning, for those of you who are working from home, you have that period where you would have commuted, where you can actually do some breathing exercises to start off the day. Some of the things that I'll also do as well is I'll have like triggers for me to, or reminders for me to do some deep breathing. So an example might be if I have two dogs at home. When one of my dogs barks, that might be a time for me to, okay, that's my bell to say, I'm gonna take a moment to breathe deeply, to sort of take stock and resituate myself in my body and in my environment, using the exercise that I shared with you earlier. Build in breaks as well. I think that this is very important. We can go for a long time, as people working. We can go for a long time without taking breaks. And as a doctor, we would pride ourselves on going for more than a day without eating. We would pride ourselves on not on sacrificing our bodies, not drinking or using the bathroom. That's the wrong thing to do, really. We can stretch our bodies to the limit, but this is really a marathon. And so what that means is that we need to take frequent breaks. Build it into your schedule. Take that time. And one of the things which I'll talk about in a little bit further is structure is your friend. Structure is your friend in these times of uncertainty. And so, making sure that you build in time to relax, time to connect with family as well. That might be limited given the physical distancing that we have to do, but thank goodness for technology like Zoom, where we can actually connect with each other. And speaking of the technology, I really want to encourage people to use video conferencing if possible. The reason why is that when we communicate, hearing the words, hearing what's said is very important, but how things are said is also very important. The how of what is said conveys the relationship. I can say, hey, I really care about you. This is very concerning to me. And my facial expression can say, I don't really care. But if I say, this is really concerning to me, I'm really wanting to support you here. Tell me how. That eye contact, my facial expression, my hand gestures convey that sense of relationship. And so, we humans not only take in information through our ears, but we take information through our eyes. And so as much as we can do video conferencing, that can really help us to form those relationships, to reinforce those relationships across physical distances.
So it sounds like it's really important to get rest, to eat well, and to kind of breathe and take a moment of staying within our routine. Um, but what about when you're at work and you're hearing things around the office about what's going on the outside? How do we cope there?
Mm-hmm. So the question is, there are things that we can do at home, but what about when we're at work and we hear people talk about things? How do we manage the stress related to that? Well, I think that there are several things that we can do. So as those of you who are supervisors or managers, I think that you can serve the role of filtering information so that the team members have accurate and reliable information. I think one of the things that is probably the most stressful about crises is the uncertainty. And when there's uncertainty, we tend to gravitate, as humans, we gravitate towards that uncertainty, and we tend to want to, be in community and talk about it. But the challenge is that if we don't have the right facts, it's very easy with anxiety and with uncertainty to magnify the situation. And so accurate information, consistent communication can be very helpful in improving the work environment. The other thing that you can do is when you're working, if you need to focus, use your earphones. Help your coworkers to understand where you're at. Team members do. Some teams will do huddles during the morning. This would be a good time to check in. Okay, what do we need to do today? How can we support one another? How can we make sure that whatever it is we're doing, we're not magnifying the anxiety and we're supporting the anxiety instead. The wonderful thing about being in a community and being part of a team is that we have these opportunities to support one another. But there's always a downside to the upside, and part of the downside to being in a team is that misinformation can also fly and anxieties can also fly. But we do have ways that we can manage that, both individually by checking with the facts ourselves, as well as our managers helping us to manage the information flow. Another suggestion that I would say is, hey, meditate together, do relaxation together, eat together. Now we have to maintain social distancing, or physical distancing, I should say. But we could do that virtually. If you're part of a team, finding a space that allows for you to be 6 feet apart, you can still see people. You can still see the nonverbal cues that are very important in supporting and building those emotional connections.
Thank you, Dr. Ton. Is there any other ideas that you may have for coping that you can share with us?
Sure. Yeah, I have a few things that I'd like to share with you. So the first thing is that when things are unknown, they tend to take on a life of their own. So when I work with my patients who have anxiety, the first thing we do is we go to the facts. And so getting a good sense of the facts is very helpful, although you shouldn't obsess over the facts. So getting a good sense of the facts isn't being on the news channel 24/7. It's more like checking in the morning, checking in the evening. That might be enough, 10 to 30 minutes a day, because in this era of communication, you can really be inundated with too much information, and that can increase anxiety and the sense of exhaustion. But stay informed. And what I also want to say about that is that, most of us are concerned about getting infected and getting sick. But what we're hearing from the researchers is that the majority of people actually have pretty mild symptoms, if any symptoms, 80% of people. And so that's a number that's really important. Think about 80% in the rest of you, in other aspects of your life. Right now, 80% doesn't feel like it's enough. And in reality, I think we need to make it a higher percent. But in comparison to the other 80% in our life, it's important to consider those factors to sort of put it in perspective. So when we're doing these physical distancing and we're sheltering in place, what does that all mean? Well, what it means is that we want to make sure that the rate at which we as a community are becoming infected is slowing down so that our hospitals have the capacity to take care of our patients over the long term. If we didn't do any of these precautions, then all of us could get sick within like the next 1 to 2 weeks. If that were to happen, our hospitals would be challenged to take care of everybody, the 20% that don't do as well. So I say this for several reasons. Number one, take the 80% in context to help you to decrease that fear of getting sick. It should still be in the back of our minds, but it doesn't need to be at the forefront of our minds all the time because it's just 20%. It's high, 20% is high, but it's not as high as many of us would imagine it to be. That's number one. The second reason why I wanted to share this with you is that in my work of health equity, I worry a lot about people who are homeless, people who don't have access to care, people who for whom health inequities impact them in such a way that they are at greater risk for those risk factors that put you in the 20% group if you get infected. Things like lung disease, things like high blood pressure, cardiovascular disease. We know that there are significant health disparities. And so one of the most important things that we can do as a community to address the needs of vulnerable communities is to make sure that we do our part in limiting the spread of illness. Because if the illness spreads, the people who are going to be most vulnerable are the people who are currently and have historically been vulnerable because of lack of access, lack of economic stability. It's not to say that there's more that there isn't more that we should do. However, that is really important, that we can do our part by limiting spread. We can do our part to address health inequities and how they manifest in this pandemic. So be informed, get the facts, but don't obsess over the information. The second thing that I'd like to share, and I talked about this a little bit earlier, is structure. Structure is your friend. Maintain a routine. If you're at home, maintain a routine. You know, one of the things that we do when working with people who've been displaced or who experienced significant trauma is we work with them to start to add structure and routine back into their lives. Because here's the thing, structure and routine decreases that sense of the unknown. It increases predictability in your environment. And that sense of predictability, consistency, knowing what's next creates that sense of normalcy. And that is really important. Take care of yourselves. Take care of your bodies. Sleep, get enough sleep. Take time to take those deep breaths, to decompress your body. Eat well. You should be doing this all the time, but you know what? This is the time to do it because we need to make sure our immune system is the best it can be. And so, and this is not just for ourselves. I know many of you on the call right now, a lot of what you do for others. And sometimes that, in our minds, that means not eating so that we can help others. I want to change that narrative. I'm trying to change that narrative for myself too, in all honesty. Because here's the thing, we're part of the university system. we're part of the institution that helps people to feel normal, to help people to feel anchored in a society that's that buffers against crisis. So we need to be there. But in order for us to be there, we need to stay well. The other reason why we need to take care of our body is we need to build up the immune system so that we don't get sick, so that we decrease the chances of infection as well. So plenty of exercise. Get exercise. You know, one of the nice things for those of you who are working from home is that you could work in your shorts. You can work in your sweats. You could do a lot of things that maybe you might not want people to see you do at work, that you could do teleworking. So there's a silver lining in all this. Take time to go outside. You know, we do have restrictions, but the restrictions don't prevent us from going outside as long as we can maintain that physical 6 foot distance. So go outside, get some sunlight. You know, these are the first days of spring. Enjoy it. Try to enjoy it. The sunlight can help activate vitamin D, which is actually part of our immune, part of the puzzle for our ingredients for our immune system. So getting that vitamin D is going to help us to build our immune system. Not to mention exercise and sunlight have been shown to help with depression, mild depression, and anxiety as well. So these are the things that you can do. Take time to unwind. Take time to unwind. You know, one of the dangers about working from home or working in crisis is that you just run yourself. There's no boundaries, and you can just run yourself from one day to the next. Make sure that you build in structure. Make sure that you build in time. Put it on your calendar. Put it on your calendar. This is a priority. Stay connected. Stay connected. Emotional bonds help us to resist disease, both from an individual physical standpoint, in terms of just building up our immunity. Emotions and social relationships actually help build immunity. So part of staying connected is, I think we're using, you know, we're using the term social distancing, and I've started to hear more that people are reframing it as physical distancing. And I like that. I really like that, because the reality is that we should not be socially distancing ourselves. We should be physically distancing ourselves. The coronavirus, in order to prevent coronavirus, we need to keep that distance, that 6 feet distance, physical distance. But the social distance, the social connection, excuse me, is what's going to help us to get through this. Stay connected with friends. Stay connected with family. I know that for some of you, maybe family or your neighbors or community members have expressed concerns. Hey, you know, I'm not sure if it's safe for you to come into my house because you work in a health system or you work in a university. And I think that's, I can understand that. I can appreciate that. There's a lot of fear, a lot of concerns. FaceTime them. Stay connected remotely. Stay with them. Stay with your friends. My son is really bummed out. He's a senior in high school, and this is, he imagined that this was his time. You know, this is where like senioritis starts to kick in, and you really like, and these are the last months of your friendships that you've developed over the past 4 years, and now he can't see his friends, and he was bummed out about it. But you know what they decided to do? And they may not have a graduation, you know, is the concern that they have. Young people are amazing. This is what they decided to do. They decided to set up a Minecraft server. So Minecraft, for those of you who don't know, is this online Lego-like world where you can build stuff. And I have to say, this, I don't know why it's still in 2020, because it looks like 1980s graphics, but my kids love it. So what he's done with his friends is they've created avatars of themselves and interacting with themselves so that they see each other in this context. They can interact with each other in this virtual physical world. But here's the thing. They're gonna build their school virtually, and they have plans to have a graduation online. And I see that some of your kids are doing the same things. We have lessons that we can learn from our kids that are born in this digital age, that have the imagination of a society that's connected through technology in ways that we can't, or that I don't. My kids always call me, Daddy, you're so old. You don't even know how to use your iPhone. Our kids are a source of support and insights as well. So this is an opportunity for us to pick the brains of our young people, those who are born in the digital age, and that's part of what they imagine the world to be. This is the opportunity. Try to stay positive. I know that's easier said than done. I actually have found that when I do therapy and I say to my patients, try to stay positive, it's like the #1 eye rolling trigger right there. Try to stay positive. But there's a technique to it, okay? The technique to staying positive is that, yeah, you may or may not believe in the positive, but that's not really the point right now. The point is to get yourself to open up your perspective so that you have more than one perspective. People who are able to maintain different perspectives are more adaptive. They have what we call the growth mindset. And growth mindsets are adaptive and really helpful in crisis situations. So here's a technique. With a situation that comes to your mind, we might think about the worst case scenario. Yeah, that is very human nature to do. But here's what I want you to do. If you think about it in that way, then what I want you to do is think, what is one opportunity about this situation? I may not believe that it's true. I may not believe that it'll come to fruition, but I still will go through the mental exercise of thinking about that one opportunity that is about this situation. The thing is, what we know is that if we build those kinds of cognitions in our brain and we do it repeatedly, we actually change how we feel and we change how we automatically think, so that then it becomes a habit. Thinking about the opportunities become a habit. And that's a very adaptive habit. So, you know, it's a skill. Being positive is not necessarily you're born with it. It's a skill that we can develop. The last two things I'd like to say is I think that we don't want to underestimate the resiliency of people. We've been through a lot as a community. I know with the communities that I've worked with, people who've lost their country, people who've lost their family and found ways to survive through that, to grow through that, to create new families, to create new communities. That's an example of resilience. It's hard to say what's going to happen in the future. But what's clear to me, based on evidence of the past, is that we'll get through this. We're resilient. We'll get through it. We have the greatest minds working on this. We have dedicated people like you to help us get through it. So stay resilient. And then I'm gonna end on three core principles of happiness that I'd like to share with you. The first thing is a sense of community. Making sure that you stay connected is a prerequisite for happiness. In my line of work, those who are most vulnerable to depression are those who are isolated. We're fortunate in this day and age where we have the technology that most of us can access to help bridge the physical distance. Stay connected, stay part of the community. The second thing, the opportunity and ability to contribute to others. The sense that we have value to others is really important. And this time, in this day and age, this is really, more than anything, the physical distancing, it's really our call to be humanistic and altruistic. Because the reality is that 80% of the people, they're not gonna get really sick. But we need that 80% to protect the 20% so that we can all survive through this well. And the final thing is growing, the sense that you're growing. And I can tell you that having worked with many, many people through crises, that there's opportunity for us to grow here, to learn new things about ourselves, new things about our friends, to develop new skills, new ways to support people. So those are the three things that I would suggest you also keep in mind, in addition to some of the more focused aspects of staying well.
Oh, thank you, Dr. Ton. Those were some great ideas and very comforting to know that we are all in the same boat together, and we can build communities, and we are important, and we can be beneficial to others in this time. So can we take a few questions?
Yes, that sounds great.
Okay, so someone had a question about the elderly and how do we convince the elderly or our elder parents to stay home?
Well, I think that's I think that that's a challenging situation. I think the first thing is to help them to understand the facts that they are at greater risk. But I would say that you know, with the work in with Hurricane Katrina, when people came to evacuate some of the elders who had lived for a long time in the area, they would say, you know, my life is in the hands of God, and so come what may. So so appealing to, I think their health may not be what they connect with, what some may not be what all elders connect with. And so the other thing that I think is important to say is that them staying home helps to limit the spread of disease so that their friends can survive, can be well, they can prevent their friends from getting sick. They can also, by staying home, they can also prevent, you know, their children and grandchildren from getting sick. Because we know now that that people who are in the millennial age category, the 20 to 40-year-olds, they're susceptible to coronavirus as well. And then I think the final point to make is that sometimes elders may feel that if they don't go out, then they're limited in their social connection. And so this is where supporting them with technology can be very helpful.
Thank you, Dr. Ton. Another question that someone had is, what are the warning signs of social isolation that a supervisor should look out for?
Well, I think that's you know, it's good for supervisors to check in with their staff, both you know, sending a message across the entire team about being proactive about their concerns about isolation, and then checking in individually as well, or encouraging people to reach out to them. Social isolation in and of itself can cause these other symptoms of distress. And so looking at, you know, looking at signs of depression, you know, irritability, feeling overwhelmed, it may be that the person isn't as collaborative as they usually are. It may be that they're missing deadlines, or or the quality of their work is diminished, compromised. Those are sort of some of the signs. Now, for some of the studies that I've seen around health professionals, our work tends to be the last thing that goes when we experience emotional distress. And so that's why I think it's really important that we check in with our folks, at least once a week, have those meetings, have those open times or open emails where people can come in and virtually speak with you or communicate via email.
Okay, and then how do you think COVID-19 will change how we communicate with each other after the crisis?
I've been wondering about that, and I think that's, again, I'm thinking about it from the standpoint of the opportunities as well as the challenges. In the near future, I think that for a lot of us, we need to rethink about how we build community, how we plan for events. I know in HEDI, a lot of what we do is gather people. And so we need to really rethink about how to do that. I think the silver lining in this is that after the pandemic, remits, we will have developed new understandings of how to connect with people and how to build community together through technology, through other means. And I think that that's going to enable us to reach more people in ways that we would have otherwise not been motivated to explore. So I think that's I'm excited actually about those prospects, because a lot of our work at UC Davis we need to do a better job reaching into communities than we've been doing in our history.
And then lastly, Dr. Ton, would you like to close with maybe a quick breathing technique to end us with some peace and serenity?
Yes. In the work that we do, we like to generally open up and then close up with a relaxation meditation. So if you can, again, find a space where you can sink into that chair, feel almost a part of that chair. Place your feet maybe flatly against the floor, so you can feel that sensation on the floor. Notice where your hands are at. Relax. Breathing in. Feel that flow of energy. Breathing out, relief. Breathing out, you sink deeper into your body, deeper into the chair. Breathing in, feeling revitalized, nourishing air, nourishing energy. Breathing out, sinking deeper, letting go. Notice that moment in between your breaths, that stillness, silence. Treasure it, and then breathe out. Now, take a couple more breaths and refocus your eyes on our conference call. Thank you, everybody, for your time. I do want to just mention a couple of things before I end my part, which is I want to thank LSFA and Yvonne and Teresa for your leadership and help with this. I want to thank Renetta Tull and the ODI team for their support as well. The technological support was wonderful. I also want people to know that we're going to start a weekly poetry book reading. And so be on the lookout for that. We're in the process of putting it together right now. Dr. Jan Marie Garcia will be leading that. She's one of the most thoughtful and deep people that I know. As well, Mercedes Piedra is looking at ways we can develop talking circles, sharing circles, and healing circles over online platforms. And so please be on the lookout for that as well. I also want you to know that there are a number of wellness resources. We don't have I have a list in my hand, but I think we don't have the technology at this point to shine it to you. But be on the lookout for that. Peter Yellowlees and his efforts around wellness will be sending out more information, and we'll post our the resources that we have online as well. So you can check our website for that. Thank you very much.
Thank you.
Really appreciate you.
And that will be the end of our session. Thank you, everyone.
Thank you, everyone.